Scary statistics from the Centers for Disease Control and Prevention, as a new report says the prevalence of foodborne illness in the U.S. remains high.
Very little improvement in food poisoning cases over the past 5 years.
According to the report, foodborne infections are still a public health problem. States' dairy products, chicken, and shellfish foodborne infections are rising.
Specifically, the CDC's annual report card on foodborne illness shows infections with Vibrio, a bacteria found in shellfish, and often linked to raw oysters, jumped 75% last year compared to numbers found between 2006 and 2008. As Health Day reports, that's the highest number reported since the CDC started tracking the infection nearly 20 years ago. Similarly, infections with Campylobacter rose some 13% over the same time period. That infection is most often found in chicken and dairy products. But it wasn't all bad news from the report. It notes the number of cases of salmonella, which is the most common form of foodborne infection, actually dropped 9%. So what to make of all the numbers? Quoted by the Baltimore Sun, the deputy director of the CDC's Foodborne, Waterborne, and Environmental Diseases Division says this year's data shows some recent progress in reducing salmonella rates, and also highlight that our work to reduce the burden of foodborne illness is far from over. So still a lot of work to do, and KTVZ points out foodborne illness might be more prevalent than many of us think. Food poisoning is a big deal. 1 in every 6 Americans gets food poisoning every year, with about 100,000 people going to the hospital. According to the CDC, some ways to avoid foodborne illness include cooking food thoroughly, keeping food properly refrigerated, and avoiding cross-contamination. For Newsy, I'm Jasmine Bailey.